One of the biggest risks of delirium hip fracture patients is pain management. And we usually treat that pain with narcotics and sedatives. And of course, too much narcotics and too much sedatives also leads to delirium. So it's a real fine line between our treatment and the disease itself.
An elderly family member or friend has just had hip surgery, and you've come to the hospital for a visit. But instead of the tired but smiling face you expect to see, you're greeted by a stranger. This person looks like someone you know well, but their behavior is completely different. They seem agitated, irritable, and belligerent, or perhaps lethargic and confused. This is post-operative delirium, and while this condition may have a number of causes, one of the most common is from the use of narcotic painkillers, a necessary measure to counteract the often excruciating pain associated with hip fractures. But there's a quiet revolution in anesthesiology taking place in a handful of operating rooms in BC's Lower Mainland, and it's improving fracture patient outcomes while substantially reducing their opioid intake and possible risk of delirium. And one of its greatest proponents is right here at Peace Arch Hospital. This is The Power to Heal. In this series of podcasts, we'll focus on the many innovative ways Peace Arch Hospital, located in White Rock, British Columbia, Canada, has been an integral part of its community. We'll take you behind the scenes of the hospital's dynamic fundraising arm and talk to those who are instrumental in creating new initiatives to help this important healthcare facility grow and evolve along with the town it serves. A new laptop-sized portable ultrasound is revolutionizing the care provided by anesthesiologists at Peace Arch Hospital. With direction provided by the ultrasound's probe, this technology's real-time imaging capabilities allow for precise needle guidance and anesthetic delivery that safely targets and blocks nerves, enhancing the effectiveness of pain management techniques and reducing the risk of complications. The result is significantly less post-operative pain following hip surgery, as well as a reduction in opioid consumption and related side effects. Here to tell us how a small community hospital like Peace Arch became an early adopter of these leading-edge portable ultrasounds is one of the technology's greatest advocates, Dr. Marshall Cheng, Department Head of Anesthesiology at Peace Arch Hospital. And joining us to share another remarkable aspect of this episode's story, in which one couple's generous donation made acquisition of the ultrasound device possible, is Sean Kenny, the Hospital Foundation's Philanthropy Officer for Leadership Giving. Dr. Chang and Sean Kenny spoke with the Power to Heal host Lance Peverly, a journalist and former editor of the Peace Arch News, and a longtime resident of the White Rock, South Surrey area.
Dr. Chang, let's start by addressing what I believe is a popular misconception, that an anesthesiologist is someone who just sits beside the operating table, monitoring the amount of drugs being used to keep the patient asleep while a medical procedure is performed. How do you see your role?
Well, there's some truth in that, and there's some falsity in that. We are in the operating room. Yes, we are. So, for those who don't know, an anesthesiologist, we do operate in the operating room. We take care of patients around surgery, including pre and after surgery, and that's our role. That's our primary role, but we're also in other parts of the hospital, especially in Peace Arch. We help out in the ICU sometimes. We help out in Emerge. We help out on the wards. In other hospitals, they run a chronic pain clinic, so we're in other areas also.
And what's your background, Dr. Chang? Why did you choose anesthesiology as your medical specialty?
I have an interesting course of how I entered in medicine. I entered university thinking I would become a journalist. This is way back when.
I hear that's a popular profession.
I grew up with Walter Cronkite. I wanted to be Walter Cronkite. But after almost failing English, decided a second career path would be better. So after about 5 or 6 years, I entered medicine. And I was really attracted to anesthesia because of So it's acute medicine. You get to deal with sick patients, almost every day. You get to see good results almost right away.
Amazing.
I was interested in physiology and pharmacology. So I finished my medical degree at UBC and went off to Toronto to do 5 years of anesthesia and a year of critical care, and then moved back to BC and moved back to the hospital by the sea, which I love.
Before we go much further, I do need to ask, anesthesiologists versus anesthetists, are they the same? Is it a regional thing?
Oh, that's a good question. I get to ask that a lot, actually. It's a hot topic now because it's American versus Canadian, right?
Oh, I didn't realize that. I did not realize that.
An anesthesiologist, it comes from Britain. So because we're educated in the British system and we follow the British system closely, we're called anesthesiologists.
Okay.
And Americans, of course, they want to be different, right? So they're anesthetists.
I do find that easier to say.
That's right.
Now, before I ask you about this new technology that is revolutionizing the care you provide, what exactly is it replacing? Talk us through the pain management techniques that were usually applied for patients with, for example, hip fractures.
That's a very, very good question, Lance. And it's a question and a topic that's really dear to my heart. One of the most common complications of surgery is delirium. And it's more so in patients with hip fractures. Patients with hip fractures get around 30 to 50% rate of delirium, post-operative delirium. And why that's important is not just because it's very common in those patients, but it's linked to worse outcomes. It's linked to more infections, more pneumonias, more heart attacks, more strokes while in hospital, and of course, more deaths. So it's very, very important that we get to treat delirium and prevent delirium in hip fracture patients. One of the biggest risks of delirium in hip fracture patients is pain management.
Oh, I see.
Right. If they have too much pain, they're prone to delirium. And so we try to treat that pain. And we usually treat that pain with narcotics and sedatives. And of course, too much narcotics and too much sedatives also leads to delirium. So it's a real fine line between our treatment and the disease itself. And sometimes, of course, we get it wrong and we put patients in delirium, right? So how we're approaching this now is trying to avoid narcotics while trying to treat pain. And we're tending now at PSARCH, and you talk about this revolutionary technique, is we're providing hip blocks, hip fracture blocks, where we inject local anesthetics around the hip capsule that's fractured. And the local anesthetic will numb that hip and provide probably about a day, 16 to 24 hours of pain relief, which is important when you're moving a patient around in bed with a hip fracture where they've got to use the commode or you've got to provide care for them. So this is a revolutionary technique. It's a revolutionary technique for Fraser Health, but it's been around for a bit in the world.
Where, for example, where?
Oh, yeah. It actually started off in Toronto.
Oh.
Yeah, of all places in Toronto. And it's used in other parts of the world so prolifically that in Australia, it's become a standard of care for hip fracture patients, a national standard of care. I think Britain also has this as a national standard of care, meaning every patient in Australia and Britain that comes into hospital gets this sort of pain management. We haven't got that in Canada yet, but I'm hoping that it starts at PSARCH.
Post-operative delirium is a common complication stemming from hip fracture surgery, with the number of patients affected ranging between 30 to 50%. The elderly are particularly susceptible to this condition, resulting in longer hospital stays and increased risk of heart attacks, strokes, and infections. Pain is a contributing factor for delirium, with the body going into a kind of fight or flight mode, as even the most simple movements can produce excruciating agony. The narcotics and sedatives generally administered to alleviate this pain can also contribute to patient delirium, with a fine line existing between prescribing too much or just enough anesthetics.
Narcotics is used. Sorry, I'm trying to figure out where this is. Is this mainly hip fractures where the delirium comes in, or is it all sorts of procedures?
You're correct, Lance. Delirium is the most common surgical complication. In the general surgical population, the incidence usually ranges between 3 to 5%, but it multiplies almost tenfold in hip fracture patients, going up to 30 to 50%, which means that half of our hip fracture patients will experience delirium. And that's a big thing because the delirium is associated with a lot of bad complications. So I would say hip fracture patients are probably one of the most high risk patients, and even more so, in my opinion, more so than even cardiac patients.
Now, I hope I don't get too personal here, but I'm told your own father's experience with delirium and cognitive difficulties after surgery, it must have been very difficult for you to watch. Can you tell us what happened and how this inspired you to seek pain management alternatives?
Yeah, thank you for that. Yeah, this happened probably about 8 or 9 years ago. My father fractured his hip visiting a friend in hospital. He actually fractured hip going up the hospital steps. So lucky for him, he got the right care right away at the right time. He had surgery, and then probably about 2 days after surgery, he started getting delirious, hallucinating, a bit of disorientation. And he recovered, luckily, within 5 to 7 days and went home. But to his surprise, after that, he found it very difficult to read and to follow conversations. And prior to that, I must mention that my dad was very sharp. He was an avid reader, loved socialization, just on the ball.
So he noticed an overnight change. He noticed a very sudden.
He noticed sort of overnight change, and it continued for months. And we now know that delirium, though short-lived, can have long-lasting impact on cognitive function. We call it post-operative cognitive decline, and it's related to delirium. Some patients with intention can overcome it. So you really have to really focus on techniques to recover from it.
I had a bit of an experience. One of my children at age 4 was having the tube placed in his eardrums.
Oh, right.
And I don't know if this is related. I remember taking him to Surrey Memorial. The doctor had told him that he did not need a general anesthetic. The younger children generally do, but he could have a local anesthetic. And then we discovered when we came into the desk, they told us that the anesthesiologist said, no, he needs the general anesthetic. They put him under, and within seconds, he started screaming and kicking. And they put me in a room with him where I held him tight, and he was deliriously kicking and scratching me and screaming. And about a half hour later, didn't know anything that had just happened. It was like waking up. And I assume this is a rare reaction. Is there any relation between this and what you're talking about? Or is it the drug itself that would cause something like that?
In children, it could be the drug. In children, it's more likely the drug. It's called emergence delirium in children. And it's usually short-lived and doesn't have long-term effects as the delirium in elderly patients.
They're not really related then. They said it was an allergy at the time.
Yeah, it's usually related to the drugs. The pathophysiology, the alterations in the brain, are not related between children and older patients. Like clinically, with children, it usually will last a few hours and then they're fine. But with older patients, they tend to last days to sometimes even weeks and then have longer complications on top of that.
Now, getting back to the newer system now, sorry, did you call it not nerve blocks? You called it...
Yeah, we call it, the acronym is PENG, P-E-N-G. And funny enough, it's invented by Dr. Peng in Toronto.
Did he have something to do with the naming then?
I wonder.
And does it just sort of dull the feeling then rather than...
Completely dulls the feeling. If it works, we are able to move that hip, that fractured hip, without any discomfort. We've seen patients within 20 minutes of the block where we can lift that leg up and twist it and turn it, and they have no sensation of what we're doing with their fractured hip.
Now, I'm guessing portability is a big factor in the effectiveness of these new ultrasound devices. Is there more to it than just convenience?
That is one of the biggest things, actually. You know, what happened before is that logistically, it was very hard to do these blocks. To provide care, you need, the right time, the right personnel, and you need the right equipment. And the right equipment can mean the logistics of it all, right? So let me explain. Prior to having this new portable ultrasound, we would have to bring patients into the operating room or into our recovery room to have our blocks done because our machine was quite big and not portable. So we would have to bring the patient to the machine instead of bringing the machine to the patient. So what does that mean to the patient? It means that we've got to move the patient with a fractured hip, painful. It would involve nursing to help us coordinate the move. And it would involve us going, coordinating with this big lumpy machine and coordinating a whole time. So logistically, it was very difficult. So once we had this new portable machine, and I have to explain the portability of it. It's a machine which is the size of a laptop. So the screen itself and the computer and everything, you can just tuck it underneath your arm like a laptop or like a book and start walking out. And the probe, the ultrasound probe where you actually put on the patient, is the size of your iPhone. So you slip that into your back pocket, you pick this book up, this laptop up, and you walk down the hallway to where the patient is at.
Sounds like it could be taken to smaller hospitals everywhere. It doesn't need the large operating room for these kind of procedures.
You're right. The other one is huge and bulky. It's almost like 4 feet, and it's on wheels and it's got cables hanging out and you got to plug it in, and it's a chore. Whereas it's pure and simple. You just slip into your pocket, pick it up like a book, and walk over to the bedside, and there you are. You're ready to go. And the patient doesn't have to move. The nurses don't have to be involved. So logistically, it made things a whole lot easier.
And not as expensive, it's sounding like, or am I jumped to conclusions there?
You asked a very difficult question. I'm fortunate enough not to be involved in the money.
You don't do the personal billing for the
I
patient?
don't do the personal billing. No. I just sit around and play with my toys. That's all I do. And I'm so lucky that so fortunate the foundation takes care of all the money and all that headache.
Well, I was going to say, why don't we bring Sean Kenny from the Peace Arch Hospital Foundation into the discussion here, since he does deal with money. Sean, your job title includes leadership giving. What does that refer to?
Yes, thank you, Lance. So leadership giving refers to our major gifts program. So any one organization or business that makes an annual gift to the foundation of $25,000 or more is included in that leadership giving group. And to be very clear, we're very, very grateful for any and all gifts, no matter the size. They all touch our hearts and make for life-saving impact. However, donors who make these profound leadership gifts are able to transform healthcare here at Peace Arch. So one avenue for impactful giving is to capital projects like the recently completed medical imaging campaign, where the community came together to fund $10 million to replace imaging equipment such as X-ray, mammography, and MRI machines with new state-of-the-art equipment that can help our radiologists detect serious ailments like cancer more accurately. So newer technologies can produce faster scans too, leading to seeing more patients each day and ultimately reducing wait times. Another really top priority for us is critically needed equipment, such as the portable ultrasound that was funded through that process here at Peace Arch. So every year, departments come together to identify their urgent equipment needs, and we select $2 million in items to support, in addition to the items that Fraser Health already funds. So not only does this save lives, but having the most up-to-date equipment really helps in physician recruitment and retention, and it gives our patients and families peace of mind that we have the best equipment available to our medical teams when they need it most. We've had many wonderful individual and organizations support critical equipment over the years, like TB Vets Charitable Foundation, funding a Hamilton C6 ventilator, or the Suu Kyi Foundation, funding an arthroscopic surgery set for shoulders.
Sean, the foundation funded the purchase of the portable ultrasound we're talking about today. What was the impetus for acquiring this device specifically?
Yes. So as you've heard from Dr. Chang, there was a clear and urgent need for this portable ultrasound. So when physicians and departments identify these critically needed pieces of equipment, the foundation partners with them to ask for the public support in bringing these pieces to Peace Arch, equipment that the hospital otherwise wouldn't have. So Dr. Chang and the OR department made a compelling case for the portable ultrasound to be on our annual $2 million capital equipment list.
I understand one couple's generous donations made acquisition of this new technology possible.
Yeah, that's right.
How does that work? Take us through the steps that started with thoughtful donors through to the purchase of this amazing piece of technology.
So after hearing about the vital need of this portable ultrasound from Dr. Chang, from a visit to the hospital from our wonderful donors, Ed and Johanna Campshire, they decided to make a really inspiring decision to fund that piece of equipment. We are so humbled by Ed and Johanna's generosity and longstanding commitment to making an impact at Peace Arch Hospital. It's such an inspiration. They and donors like them really take pride in choosing a particular piece of equipment and then hearing about it after it arrives. Our doctors and medical teams love being able to explain the impact of the equipment and thank the donors directly.
Is there a list or something? Do you ever post items online where you say, this is what we would love to have? Some of maybe the smaller items that aren't going to be the major campaigns for that year?
The more common route to getting involved in giving to critical equipment, like the portable ultrasound, is through our website, pahfoundation.ca, where you can find the current catalog of our medical equipment in need and how to support it. On the list, you'll find equipment that can be supported for, say, $2,500 and all the way up to $200,000 and everywhere in between. Not to mention, you can always give a gift of any amount to be designated to a piece of equipment of your choosing. We've had many donors and organizations that have combined their gifts to make that piece of equipment a reality at Peace Arch. You can always reach out to myself or any of our staff if you're interested in supporting medical equipment, and we'd be honored to help you through the process.
In order to avoid the use of narcotics, nerve blocks targeted with the aid of the portable ultrasound are applied as early as possible before hip surgery. The blocks are effective for a period typically lasting between 16 to 20 hours, taking the patient through the operation and into post-surgery. However, with the bones now repaired and not coming into contact with each other, pain is usually decreased and reliance on narcotic medications reduced. And in terms of usage of pain blocks assisted by the portable ultrasound, Peace Arch Hospital is a clear leader, utilizing this technique in approximately 90% of hip fracture procedures.
Dr. Cheng, let's go back to how common is the usage of these portable ultrasounds for pain management after surgery? Are you helping break new ground here in Western Canada?
That's a good question. There's three parts of quality care. One is providing at the right time and having the right personnel and having the right equipment. And having this equipment, having this portable ultrasound, puts us onto a different sphere. Having this equipment has actually made this possible. Without this new equipment, we would not have had this block program or been able to reach these patients and prevent delirium.
When did you get this device?
We probably got it about 2 years ago.
Would you happen to know how many procedures for hip surgery have been carried out at Peace Arch?
Oh, this is a good question. So, Peace Arch, being such a small hospital, we do the highest amount of hip fractures in Fraser Health. So we're hitting...
No idea.
Yeah, most people don't. So we are treating the majority of hip fracture patients in Fraser Health with this program and with these blocks. We're making a big impact, I believe. Certainly, I've been privy to some of the data on delirium in Fraser Health, and I think about 2 years ago, they showed a reduction in delirium in Fraser Health in elderly patients. I have to tease out the data a bit more.
Sure.
But I'm wondering if it could be linked to this new equipment and our use of this new equipment and providing these blocks.
How many hip surgeries does Peace Arch do in a year then?
Oh, I don't really know. We probably do, I would say, 1 or 2 a day.
Oh, wow.
Yep. That's a lot.
That is a lot, especially for a hospital size of Peace Arch.
That's small. Yeah. Yeah.
Now, I'd like to ask you, does having access to cutting-edge donor-supported equipment like this at Peace Arch help attract top medical talent such as yourself?
100%. Having the right equipment and having the support of the community and the foundation. I'm half kidding when I say I don't worry about the cost, because the medical community at Peace Arch, if they want something, they just approach the foundation and it's always yes. It's never, how much will this cost? I don't get that from the foundation. And it's such a blessing as a medical professional just to concentrate on medicine and know that Peace Arch and the community has your back on everything else.
In the future, do you see more applications of this nerve blocking technique to improve patient outcomes and reduce the need for strong pain medications?
I do. I know that Langley is trying to copy us. I know that Surrey Memorial is trying to copy us. I know that Royal Columbian is trying to copy us. I'm just hoping they have a foundation like we do.
Yes. It's supportive. In addition to hip replacement, though, what sort of procedures could this be used for?
So what we use it for now is providing nerve blocks for after knee replacement surgery. Knee replacement surgery is quite painful, and we have to move the knee after surgery. Otherwise, patient develop contractures and immobility, so they have to move through pain. So what we do now is we do nerve blocks to target the knee, so these patients can be comfortable after surgery and be able to mobilize and walk around after surgery. We also use these blocks for hip replacement surgeries. So it's the same sort of thing, same sort of concept, and we use that for that. We use it for shoulder surgeries, which are very, very painful. You can imagine we have to move that shoulder after surgery. Otherwise, you're frozen. So we inject local anesthetic around the big structures here. There's a lot of arteries and nerves. We use the ultrasound to perform it safely so we don't hit the big arteries.
It sounds like anything with a joint in the body could be used in that area, or is that too general?
Almost every joint. Yeah, almost every joint. And we use these ultrasounds to perform the block safely because usually the nerve is around a big blood vessel and is around other structures. So we just try to pinpoint the nerve instead of hitting other structures as we use a needle in there.
This will be life-changing for people having these procedures.
Definitely. There's a big difference. We've noticed a big difference in mobility after using these techniques and patient satisfaction.
Well, Sean Kenny, just to wrap up, what does this say about our community of White Rock, South Surrey, when generous donors step forward to help fund important equipment like the portable ultrasound?
Yeah, Lance, simply put, it saves lives. I'm just continually in awe of the open-hearted generosity in White Rock and South Surrey. I've made connections with so many incredible people who are so passionate about having the best community hospital in the world, making astonishingly heartfelt gifts because they want better health outcomes, not only for their families, but for their neighbors' families as well. Having state-of-the-art equipment means staff are able to perform more in-depth procedures and perform routine procedures faster. What does that mean? Well, it means they can perform more procedures for patients here in our own backyard and reduce wait times with faster procedures. I'm really honored to say that we've had Peace Arch Hospital staff, physicians, technologists, and nurses' faces just light up with joy when they see a donor-sponsored piece of equipment like the portable ultrasound come in. We also see that when the latest technology comes in, there's a greater breadth of equipment to use. It attracts staff to Peace Arch Hospital. We know the community support has saved countless lives with their generosity, and on behalf of the entire team at Peace Arch Hospital Foundation, we're just so grateful for you. I truly can't say enough.
My thanks to Dr. Chang and Sean Kenny from Peace Arch Hospital for speaking with me today. And thank you to all the donors who help keep our hospital on the leading edge of community healthcare.
Thank you, Lance.
Thank you very much.
The Power to Heal podcast, presented by Peace Arch Hospital Foundation in White Rock, British Columbia, takes you behind the scenes of an innovative hospital foundation and introduces you to the team who find new and sometimes surprising ways to engage with the local community and help fund the best healthcare possible in the region. Since 1988, the foundation has raised over $250 million for capital projects, medical equipment, and community health programs. Their passionate and caring team's number one priority is the prudent stewardship of your gifts and the resulting positive impact on patients and medical staff at Peace Arch Hospital and the entire White Rock, South Surrey community. Peace Arch Hospital Foundation, where innovation comes to life in so many ways. The simple act of giving is truly transformational. Every dollar we receive is enhancing healthcare in this community, whether it's supporting our capital infrastructure, the purchase of essential medical equipment, or funding a wellness program like stroke recovery or a children's club to encourage healthy habits and active play. Our wide range of giving options includes monthly donations, an increasingly popular and convenient choice that makes the greatest impact on your community hospital. You just sign up once and the rest is automatic, and that includes receiving a consolidated tax receipt at the end of the year. But no matter what giving option you choose, it all matters and it all makes a difference. Be sure to subscribe to Power to Heal wherever you get your favorite podcasts. Each episode brings you inspiring stories about the Peace Arch Hospital Foundation and its innovative approach to supporting better healthcare throughout the White Rock, South Surrey community. Thanks for listening.
Another Everything Podcast production. Visit everythingpodcast.com, a division of Pattison Media. Subscribe wherever you get your podcast.